Cheers! Hey guys, welcome to my channel, The Ready Nurse Nay. I make videos on nursing, inspirational, and health related topics. So go ahead and like and subscribe and leave a comment at the end if you like this video. So today's video, we're going to be talking about my pediatric overview. So I'm a nursing student right now. I'm in my third semester, and this semester we had clinicals on the pediatric unit for 3 weeks straight. So I'm going to kind of give you an overview of some of the things I saw, the hospital that I worked at, how I liked it, and just all the good details like that. Okay, so first I worked at a major hospital, a major pediatric hospital in my area, and this hospital may have been built, it may only be 5 years old, so it's a brand new hospital. They have all the new features, and it was built with like kids in mind. It's just very colorful. There's actually like a cool playground, a hospital playground for the kids. You know, if they're well enough to go into the playground connected to the hospital, they can go and kind of play in a safe environment if they're well enough to be able to do that, or if they have siblings that come visit them. You know, any kid coming to the hospital, visiting the hospital, they can use that hospital playground, which is really nice. It has like little castles and like little play houses and play castles, and it has little hills. There's like little water fountains, little areas where you can maybe go meditate or pray or something. It's just really cute. So each floor also has its own theme. So like say the second floor, it might be the beaver theme, and it might be brown with like beaver pictures all over. That's the air conditioning in the background. Bear with me, I'm outside. But the second floor might be the beaver floor. They have pictures of beavers and things like that. The third floor might be the octopus floor, and right when you come out the elevator, the wall is purple, and they'll have just kind of like different random things, like an octopus picture here or something, just very cute for the kids. So it was really nice. So they also have gift shop, where you can get your food and things like that. It's really nice, really cute. So when we got to the floor, and also it's like very like controlled with lockdown. Nobody is just going in and out of there with the floor. You need badge access to be able to get to hallways, and you need a lot of access. So it's very secure as well too, which is nice and safe because you're dealing with children. So I guess what's some things that are nice with the room? Each room has their own set of vital sign machine that's like connected to the wall, so you don't have to go looking around for vital sign machine. Each patient has their own vital sign machine in their room connected to the wall. Another thing that's kind of a safety feature, the rooms don't have a shower and tub combo. It has a bathroom with a sink and a toilet, and I think it's just like a safety measure. So there are like family shower rooms that are outside of the patient room, like in the hallway, and so the parents can go there and shower or bathe their kids there as well too. If it's safe for the children to go there and take a shower or a bath, they can go in there and get assistance with that. So that was nice. Some other nice things, nice break room, coffee, fresh coffee all the time. Just a very nice hospital. And then they have the basic things like the medication room, the equipment room, the supply room, the nutrition room where they can store your breast milk if you're breastfeeding for your baby. There's just different foods and different things like that, ice cream, jello, if you know you want to give those type of things to kids. It was a nice hospital. So first, I guess I want to tell you some of the things that I saw. For the most part, in a pediatric hospital, they basically take a brand new baby all the way up to like, I want to say 18 and sometimes 21. They can go to the pediatric hospital. So yeah, that's the wide range. For the 3 weeks, I had a mix of different patients of all ages. Of course, as a student, we're paired with a nurse, and we follow that nurse around with her patients, and we take care of those patients. So we're able to kind of see what type of diagnoses and disorders that these kids have, what made them come to the hospital, what type of medications they're receiving. We can give them their meds if they have any type of like nursing procedures that need to be done, whether it's NG tube, IVs, Foley catheters and things like that. We can actually do those, perform those. We've been trained and we know how to do those. I know how to do those. So it was, yeah, I would say for kids, anything, they have the same bodies as an adult, so except much smaller. anything that can go wrong with an adult body, any type of issues and disorders that an adult can have, it can be the same thing with a kid. So these kids, you know, they had a lot of like intestinal type of issues. There was a lot of like bowel obstruction, you know, so where maybe the child has to get an NG tube so they can drain out their stomach and then help to restore proper function of their intestines so they can get to pooping normally. There was a lot of that. Make sure you're pooping and your kids pooping regularly, okay? Because if not, you can go, it can be a trip to the hospital. So there was a lot of that. There was a lot of they had kids in there with seizure disorders. They needed spinal taps, meningitis, whatever an adult can have, a child can have.
Mom,
so
you're coming?
that was my son coming outside. But anything that, any type of issues that an adult can have, a child can have. They can have cancer. They can have STDs if they're active. They can have any type of issue that an adult can have, a child can have as well. So yeah, I think my experience with it was a good experience to know that. I mean, definitely God bless some pediatric nurses, because it's very, I think for me it was very hard to see those kids sick like that. To see kids who can talk and tell you when they're hurting and they're scared because they don't know what's going on with their body, especially like young babies and toddlers and preschoolers. It was kind of hard for me to see that. So I think because of that, I don't know if I could work at a pediatric hospital. For me personally, just me personally. But God bless those nurses, because man, they were on it, taking care of those kids. A cool thing about the pediatric hospital is that the parents, they can stay with their children. And so a lot of times, yeah, I'm outside and it's just picking up all the noise, but we're gonna just go with it. But a lot of times the cool thing about a pediatric hospital is that the parents are there and they're helping take care of their children. They're helping soothe them and calm them and comfort them. They're helping to bathe them if they need to be bathed, which is a big help on the nurse. So, I mean, that's an awesome thing too. Whereas if you're working on the med surg unit or you're working with adults, that's not necessarily the case. As a nurse, you're gonna be doing more of those functions because, you know, they don't always have family in there who can help or who feel comfortable helping. So that was a cool thing about that. And I would say, yeah, all in all, it was a really great experience. I got to see a lot. I learned a lot. The cool thing with clinical, when we're going to different specialties, is like, as a student, you're able to kind of learn about yourself. You learn like, do I like this population group? You know, can I handle the emotional aspect of working with sick kids? You know, can I not handle it? Is it too much for me? You know, it's kind of sad. You know, I'm a mother and I have my own, you know, my own child and my own family. So, you know, it's just very sad to have to, you know, put an IV in a child because it hurts, you know, or have to put an NG tube in a child, or a Foley catheter in a child who's already sick and scared, and then you have to do these things in order to help them feel better. So that was kind of hard, difficult for me. But the nurses that do it, I think you guys are awesome. You're rock stars, okay? And we need you in there. So I think that's amazing. But that's the cool thing about clinical. You get to kind of learn about yourself. You learn like how you are in different situations. You learn what you like, what you don't like, and what kind of specialty you might want to go into when you finish school and become the registered nurse. So I am going to put pictures and videos all throughout the video and throughout the end of the units. And I hope you guys enjoyed this content. Like, comment, subscribe, and drop a comment below, okay? And keep on following along from the journey, because your girl is graduating next year and I'm gonna be a registered nurse. So I'm excited, and I enjoy sharing the stuff that I'm learning with you guys, because it's interesting and it's fun. So love you, peace and blessings, and I'll see you in the next video. Bye. This is one of the family bathing rooms on the unit. Every unit has a crash cart in case a patient codes. This is the equipment room. There's everything in here from wheelchairs, extra IV poles, scales to weigh a child, feeding pumps, and even things in here for oxygen if a patient needs oxygen. This is the nutrition room. A mother can store her breast milk in here. There's also extra food and goodies in the refrigerator for older children or even parents who may need a snack. And this is a picture of me at the hospital playground.